So more than 34,000 people have been killed in Gaza, mostly women and children. The United Nations Special Rapporteur on the Right to Health, Dr Tlaleng Mofokeng, has accused Israel of treating human rights like an a la carte menu, saying human rights are not about pick and choose. Tlaleng says since Hamas attack inside Israel on October the 7th, the medical infrastructure was damaged. Let's now speak to Dr Tlaleng Mofokeng, who is back on her presentation, and this is on the back of a presentation yesterday in Geneva, and she joins us now via video link. Dr Mofokeng, good morning. Thank you so much for making time for us. How would you describe the current situation in Gaza?
What we are witnessing is a real-time genocidal act with a clear intent from an occupying power, which is represented by the Israeli government. And none of us can be shocked about the horror that has been unfolding for the last 2 months. They articulated as such, and they have done as much in their actions. The total and utter destruction of Gaza, including the healthcare facilities, including the harassment and targeted killing of healthcare workers, violates multiple international human rights law, humanitarian law, but also directly the right to health. And we see this as an acute episode on an ongoing chronic display of violence, of imperialism, of colonialism, but also very, very important to remember that Israel is being aided by allies all over the world to enact this genocide on Gaza at the moment.
Speaking about Israel, have they ever met with you?
Not face to face. I did write to them on the 4th of December on an urgent appeal, and that's a method of work that's available to me as the UN Special Rapporteur to engage with member states on an urgent basis on either future ongoing, past, or future human rights violations. And at the time, I had received several allegations from victims in Gaza on the situation of their right to health. And unfortunately, since then, there has been no acknowledgement or engagement with that letter. It has since gone public, of course, in February. But I continue to say to them and demand an immediate ceasefire, because under the current violent acts, it's impossible to recognize, realize, or even promote the right to health of Gazans as human beings and rights holders. But we have seen how aid workers, UN staff, the United Nations itself is unable to actually fulfill its own mandate on the ground because of the bombardments.
Yeah. Dr. Mofokeng, what should we then as the ordinary public read into this? That you have the powers and the authority to engage with the nation states. However, though, in this particular case, you have a letter that you've sent to Israel, and Israel is not responding, and Israel continues to also make allegations, including that, amongst others, they believe that they are providing the type of support that is required in Gaza.
They are absolutely not. And I think what we need to be careful of is when people repeat a lie over and over again and they eventually start to think that we will believe them and think it's the truth. The truth of the matter is the Israeli government, including their allies in the European, also in America, have been aiding them with millions of dollars and military arsenal to continue a genocide. There are consequences to that genocide in terms of multiple complex injuries. But what we know is that Israel has also ignored the International Court of Justice when they gave them an order to make sure that they prevent a genocide. And what's important to also understand that they've ignored the Security Council, they've ignored the General Assembly. So the bigger question for me is, what do we do in the multilateral system when a member state can actively ignore human rights standards and norms and laws and ignore the highest bodies of the UN, which is meant to be there to keep themselves as member states, as peers, accountable to human rights? And what are the failures? And can we really be honest in that the world leaders we have right now are fit for the situation? And I think the answer is no.
Yeah. While you speak about Israel being aided by its allies, just recently the House of Representatives in the U.S. Have given the green light for the military aid to Israel. I'm going to specifically focus on Israel here. 26.38 billion rand for Israel, including 9.1 billion rand for humanitarian needs. However, though, that bill goes on to say that that funding, the humanitarian aid funding, will not go to UNRWA because of the decision that President Biden had taken, that no funding should be going to UNRWA. And we know the work that UNRWA is doing, including when it comes to making sure that there is the medical needs that are required by the people in Palestine, making sure that that's being made available.
There's several things there, right? That the package aid is in US dollars. It includes dollars and military weapons. And the fact that it's so clear that member states of the United Nations can decide unilaterally to divest and stop investing in critical infrastructure and critical organizations of the UN, such as UNRWA, on the ground to provide relief in this time of the worst crisis of our life in terms of witnessing it in real time. And that goes without a revolt, right? What is the role of the UN Secretary General when the UN's mandate is being undermined in such manner by the member states of the UN itself? There should be an absolute rage and fury and revolt. And this quiet diplomacy that we see happening, for me, it's actually a showing of a lack of a leadership. It's a lack of a compass. It's a lack of a clear strategy of how to get all of us, everywhere, all the genocides in the world, DRC, Yemen, Syria, Gaza, all the protracted wars in the world, how will they end if in the face of one of the worst genocides to be documented by its own victims is led on to go on in this manner? And the UN is held to ransom by member states. They understand divesting. But when students, when civil society, when academia, when independent experts of the UN speak the truth, they get punished. They themselves are being at risk of harassment and intimidation. And yet we have member states who clearly know how to punish and divest, even from the United Nations and its own mandate, which is absolutely despicable. It's a show of colonial imperialistic power, and this is the power that Israel government depends upon to shield them from accountability on all levels all these years.
And when Joe Biden made the announcement around stopping funding for UNRWA, it was based on the allegation that Israel has made that there were some members of UNRWA that were involved in the October 7 attack. An investigation and a final report has now come out from the French foreign minister, former foreign minister, Catherine Colonna, and they couldn't find any evidence to that effect.
And that is the point, and that's what we had been saying from the beginning. If you remember from the 7th of October, many of the reports that they were being laid and foreshadowed by that government have been debunked as lies and lies and lies. And yet people continue to make foreign policy decisions based on those and make their cooperation internationally based on those lies, including UNRWA. And I think that is where the shame for me lies. And the world leaders must carry the shame of this genocide. They must carry the shame of the decisions they have made, and they must carry the shame of their own inability, their own self-imposed passiveness at the face of children, women, prisoners, doctors, journalists, of the entire population being targeted in the way that it has. Remember, Gaza is not a natural geographic unit. So it's not like before October 7th, all was well in Gaza. Not everything was well in Gaza, far from it. So the Gaza we need to imagine, the occupied Palestinian territory that is liberated, that we all need to imagine, cannot be what was there before the 7th of October in any case. And so the kind of leadership we need to move forward can't be the one that gets swayed by lies and misinformation and disinformation. And they themselves beat the drums of war to then justify a genocide based on those very same lies. It is shameful, it is despicable, and there is no place for that kind of foreign policy or international solidarity, especially at the face of a genocide.
Yeah, and at the end of the day here, we're speaking about human beings here, and also looking at UNRWA's report saying that a child dies every 10 minutes in the enclave, 34,000 people that have died. And the point that you've stressed before is that this number could also be grossly underreported, considering that you could have some people that are still stuck under the rubble and people who are dead as well under the rubble.
And I think there is something to talk about the dignity in death and dying, and the dignity of how we treat our beloved when they have died. In this particular case, we need to understand that the martyrs of Gaza are scattered everywhere in that strip. We remember early on, people were making graves with any space they could find, any space whatsoever. But we've also seen the literal epistemic injustice, epistemicide, in the way that the grave sites in Gaza were also destroyed by army tanks. We've seen the inability of people in Gaza to mourn their loved ones and do their usual funeral and cultural processions and traditions to mourn in dignity their loved ones. So for me, the idea of the right to health, and why I'm always saying we need to practice and realize the right to health and remember how much of restoring of people's dignity is important in how we approach the right to health. In life and in death, people deserve that dignity. And right now, whether you are alive or dead in Gaza, you have no dignity. And we ought to fight for that, because that is the basic fiber of us being human. It's that dignity and that sense of being and self-determination. And you cannot extinguish that desire for freedom in people. And peace will follow, but it only ever follows liberation. For as long as there's an occupation, there will be resistance. And so the only way forward for true, meaningful peace is there for the occupation to stop, for an immediate ceasefire, and therefore for allowing Palestinians to self-determine.
Finally, what's the status of all the hospitals in Palestine? The one that we've been reporting on a lot is, of course, Al-Shifa, but looking at the attacks on other hospitals as well, what does it stand at?
So the WHO has been really important in providing us some analysis and data on this, because it's incredibly difficult to get any information because we can't get on the ground. We know that the functionality, truly, if you have to measure functionality of hospitals, more than 99% of hospitals and clinics in Gaza are not functioning. What is functioning is humanitarian aid, field hospitals that have been set up, and some limited resourcing that, of course, comes through UN agencies. So the situation of health is completely dire. The right to health has been under attack from the very beginning of this war on Gaza. And right now, there is no right to health that can truly be realized in terms of quality of care. There are no commodities, but also underlying determinants of health such as food and water and sanitation. So the situation is really, really dire with acute and chronic medical illnesses, airborne and water illnesses, but also other chronic illnesses that people have, and cancer treatment that is now, of course, no longer available for them, even though it was already still insufficient before October 7th.
Dr. Mofokeng, thank you so much for your time. That is Dr. Tlaleng Mofokeng, who is the UN Special Rapporteur on the right to health, specifically focusing on the situation in Gaza.